I would like to thank everyone for joining in and for taking the time and the connectivity to share in this conversation. I am inclined to think that the notion of post-COVID-19 Africa presupposes that we will soon have an Africa which has either discovered and applied an affordable cure or vaccine, or we will have acquired disease-induced herd immunity, suffer from the disease, recover, and then develop immunity. Or maybe we will have reversed the infections, possibly cured all the sick, and there will be no more infections. At present, I think Africa lacks the capacity to achieve this on its own. So the future is unpredictable. And because of this, we are looking at serious experience, learning, and adaptation towards a pandemic that we presently have little control over, apart from possibly avoiding it through distancing and hygiene and other things that have been prescribed and tried but in vain. So the future of Africa should be of great interest to all of us, not in terms of how fast Africa controls the disease or whether it invents and accesses a vaccine or cure or develops immunity, but especially in how much preparedness and capacity we build to manage future complex public health emergencies that may erupt in future and possibly attract less attention than coronavirus. But Africa has shared the brunt of the coronavirus, even when so far we are the least affected people, because of its impact on global trade, travels, and other forms of relations and exchanges. Africa seems to have had unprecedented relative resilience. Some people have started to suppose that we have acquired herd immunity, but the idea is that because many Africans have been suffering different epidemics over time, the initial shock that afflicted the world as a result of this infection enabled Africans to slightly take great care. And this is why from the time we got the first infections or recorded the first cases in any of the African countries to the present time, the rate of spread within Africa has been slow. The unfortunate reality is that we have the weakest response capacity. Our infections are increasing. Our health systems may be overwhelmed, and we may live much longer with this infection. We need adaptive political and socioeconomic responses to be developed, even as we think of sustaining the pre-existing regionalism processes of regional integration that had tried to enable Africa to really build its capacity for intra-Africa trade and exchange. We have now a wake-up call about our technological and scientific and development. Shikwati mentioned it. Our industrial and technological relative weakness have now been more and more exposed. Our geopolitics is affected. Even political configurations within our countries are affected. The future of Africa is unpredictable because of that disruption. The economic future is also disrupted because our rate of intra-regional trade has reduced. The techno-scientific and possibly future of ideas and industrialization is also uncertain because the partners from the north and increasingly the east with whom we use it to trade and relate and exchange technologies are going to hold on as they try to recover from this infection. I think at the end of the day, we have to develop serious policy and technical processes that will strengthen our industrial and technological development to reduce our dependence on the outside world. If our medical systems and our health products and services can be brought to the global level, then that would be important in positioning Africa in a place that can make it survive future infections, if any. Finally, I would like to say that African responses focus on mitigating the rate of spread, flattening the curve, but infections are increasing and death. So our fragile health systems can be overwhelmed, and therefore, without treatment, without immunity, and without certainty of the vaccine, the future remains elusive, unpredictable, and the present precariousness of the situation should be given serious attention, both amongst thinkers, policymakers, and practitioners.
I'm in the field of ICT for development, and this is a new paradigm concerned with the use of the use and design of ICTs to improve socioeconomic well-being of communities. My feeling is that this is the paradigm that will and should help Africans. We have had a real challenge during this season of COVID-19 with universities closed, and of course all the schools, secondary and primary, closed. And we need to take up the challenge as Africans. This pandemic has really exposed loopholes and opportunities, I would say. Right now, there's a lot of training and retraining in education. And of course, new technologies. We have a lot of and political will in using some technologies. With the embracing of technology, and especially ICT for development, this could really help. The small-scale farmer, because they would get accurate information. They would also modernize their methods of farming through information that would be effectively passed using these ICTs. We have a number of challenges. These challenges are facing Africans. Now, there's the syndrome of piloting projects. A lot of monies has been put in projects, but you see, there's no plan for rolling out those projects. A lot of maybe agricultural projects, they use ICTs, they demonstrate, but after that, there's no follow-up. There's also what we call unsustainable large investments, and especially in the area of ICT. Those are challenges facing Africa, and we need to advise the political class to rethink their way of investment, and even the donors, they have to rethink the way they invest. Then again, there's another challenge of users not willing to pay. You know, services are not free. There's bundles, internet bundles, and all that. So users there should be a lot of training to allow users, and these are small-scale farmers and all people in the rural areas. They should be made to understand that there's a lot of value in the use of ICT.
At a general level, in terms of how to think about the use of law in terms of public health, the first intervention that I'd like to say in a very general way is that besides the way that we teach criminal law, I myself am a criminal lawyer and I practice international criminal law. The way we teach it is as a responsive measure. In other words, first people should do an infraction and then we punish them through arresting, prosecuting, and imprisoning. But what we are seeing emerging with COVID is actually a large bulk of what the law should be and what the law is in terms of preventing risks. The point I'd like to make is that a large function of the law is preventive. We don't have to wait for a crime or antisocial behavior or deviant behavior. It's a legitimate function of the government and the state to provide security for the population and therefore to prevent a health epidemic. And preventive justice is different from retributive justice. Retributive justice is about responding and punishing. But here we are concerned with, instead of redressing wrongdoing, we are focusing on preventing harms. catastrophic harms, and a pandemic is a catastrophic harm, and there are exceptions made against the freedom of association, the freedom of movement, the right to liberty. These are not absolute rights. So we can derogate from them, and the state has a legitimate basis in doing that in order to prevent a pandemic or any public health disaster. And there are debates about whether we should invoke emergency law and we should declare a state of emergency. I myself don't think a formal state of emergency need be declared. I think there is a standing public health provision in the Public Health Acts in most jurisdictions, like in Kenya, which permit the health authorities, whatever the infectious disease or contagious disease is, to invoke crisis measures, and WHO has declared COVID-19 to be a pandemic, and therefore it's legitimate and appropriate to have restrictions on travel, immigration, and also the quarantine measures. I don't have a difficulty in those. The question would now turn to the situations of fact. Has somebody actually come from a COVID zone where they are warranted to be quarantined, or is it being used for political advantage? I know of many of my clients who they are found loitering around after COVID hours or without a mask, and for that reason alone are being quarantined. People are having to escape from quarantine facilities, and they are challenging the wrongful detention without trial. My argument has been that quarantine is legitimate if somebody is exhibiting COVID symptoms, and it's for protection of the wider population. And the issue may be whether they can afford it or whether it should be done at state cost, because it's involuntary and people are being charged a lot of money. In our terms, 2,500 shillings, which is, let's say, $25 per day for quarantine. People can't afford it, so they are not submitting themselves for testing, and they want to avoid quarantining. They want to avoid quarantining for their families, and that becomes more dangerous. So there are questions of sensitization on the benefits of early testing, so that it's for our own benefit and not to spread it. And being sensitive in Africa for burial practices, you know, there are these people who come in white uniform and they have summary burials at midnight, and the dignity of deceased and of communities is not being respected. So there's a lack of sensitivity around that. So that's an overview of preventive justice, which I think is becoming, is based on profiling and targeted testing and so on. The courts have been closed. My office has been closed. My court clerk doesn't have work. He was even locked at his upcountry place. He couldn't come for 90 days, and I was paying his salary, and I couldn't pay. I stopped. So the first thing, we are going into a new normal whereby now, first of all, we are eliminating. We have been so slow to come to stenographers and so slow to come to electronic hearings and electronic witnesses, electronic evidence. We have moved there overnight, so that we don't have process servers, and I don't know, it's going to revolutionize the justice system. What we've been thinking has been a conspiracy by power brokers not to make the records available and transparent and hiding files. That has gone out of the window overnight, and maybe that's a good thing we've been forced to do. But the impact is we're going to lose a lot of manpower, the same way that banks lost bank tellers. Now we don't have a lot of intermediary staff, and there's going to have to be joblessness at some level.
COVID-19 has been disruptive and destructive, and we didn't have to wait for COVID-19 in order to develop our capacity in healthcare system, our social infrastructure. And so COVID-19 has caught us, I would say, unawares. But there's a silver lining, because if change cannot come by desire and by planning and reasoning, it can also come by compulsion. And that is one of the triggers of human change that we can learn from Aristotelian philosophy. And I would also like to go back to what the first speaker referred to, which is the need to develop adaptive capacity, because this disease will be with us for a long time. And so it is not a one-time shot. It is something that requires us to develop long-term resilience. And with this disease, we have seen a lot of policy statements coming up. How can we develop resilience, recovery roadmap, and even research? So talking of the social safety nets, Africa has not been known for social safety nets, but there's a lot we can learn. And we cannot leave out the question of governance and vision. How is our leadership prepared to deliver on that? For example, when we are looking at COVID, fighting COVID in Africa, how are the task forces formed? The way we form our task forces, if we think this is just a disease that should be combated by the knowledge and skills of health experts and scientists alone, then we are wrong, because it has a strong component in behavior and attitudes. There are attitudinal barriers to change. And this is what has been dragging Africa backward for a long time. I would like to give the example of Germany, which is a premier in engineering and science, but looking at the task force that Angela Merkel formed in order to address COVID, it is heavily composed of experts in humanities, including historians of science, including philosophers, including psychosocial support specialists. And that is recognizing that we need to address a fundamental component that is in the social system and the related social infrastructure that we need to support that. And so in conclusion, I would say that it has been a great test to us, but we can learn from it by developing our social support systems, our community-based systems, and coming to Africa, for example, where we address this problem through very strong community systems, opinion shapers coming in, then you find that we are able to address the diseases of attitude, people not wearing masks, and people interacting freely. This can be addressed by the fundamental social system, the principle of subsidiarity, going to the lowest level where it is more effective. We cannot always think of things, change coming from the top. We also have established community systems that we need to nurture and that we need to strengthen. And that will be a good start to the debate of establishing robust social support system and even social safety nets, which we can advance into the policy arena and policy innovation. Fighting COVID is not just a matter of technological innovation, it is also policy innovation, and it is also behavior change. And behavior change agency, I can say, is urgent.
COVID is a health pandemic, but it has impacted education so much because nearly all educational institutions faced closure. And with this closure, it meant learners were sent back home. Most institutions and countries resorted to online learning as a solution. But with online learning, the challenge is that, for instance, it's a fact that globally, nearly half the world population does not have access to internet. And when we draw closer home in Africa, we have only about 24% of Africa's population having access to internet. And this access is still affected by issues of poor connectivity, exorbitant costs, and sometimes power outages, and so on and so forth. Therefore, we cannot say that there is equality, questions about equality. And of course, when we revisit the Sustainable Development Goal number 4, that talks about equality and inclusivity in education, in provision of education, then we find that we are not sharing the world space that we are supposed to be sharing in the education sector is not necessarily shared. Why do we say this? Because the effort to have education sustained online or provided to learners online brings about the questions of the digital divide and questions of discrimination, because there are gaps pointing towards exclusion and inequalities in remote education, not only in Kenya, but in most of our countries, where we have some countries struggling to reopen and others have already reopened. Still, learning in those institutions is not guaranteed, because we know for a fact that, again, Africa, unlike other countries in the world, face a lot of limited educational facilities. And therefore, with the COVID era, the education landscape has been affected quite negatively and strongly, for that matter, because effort has been put to rely on radios, for example, TV transmissions, and some digital tools to transmit knowledge. This transmission is limited in the sense that even the educator themselves, some educators are also affected with the digital challenges and so on and so forth. Therefore, what is this that could be done, even as we struggle to shape a new normal? Because we are saying that as things are, the continent needs to rethink creatively and in an open-minded way, so that our scholarship can engage in deeper inquiries to examine issues relating to our own environment more deeply within the education sector, because education, for a fact, is a sector that drives innovation, drives development, and all development agendas revolve around education. Therefore, if we are going to have the other sectors affected amicably handle or address their issues, then we need to first handle the inequalities that we are witnessing in education by coming up with the innovations for the future that can ensure that inequality, not only in education, but also in other sectors, are addressed in future times of crisis, in case we face similar situations. There's a lot of effort, as the earlier speakers mentioned, not only at the national level in different countries, but even as a continent, effort to ensure that educators or trainers are given more skills and exposed to how to move the education agenda forward in the post-COVID era. For instance, there's training on technology-enhanced learning that I think is going to begin across almost all universities in the continent. That is from next month, a 2-week training that is going to equip especially university trainers, teachers, lecturers, with more skills on how to integrate technology in enhancing their delivery of knowledge to learners. The biggest challenge that we face, of course, and the biggest dilemma in our situation as a country, Kenya, where I come from, is that, for instance, if we say we are opening our universities or our educational institutions, with the overpopulation of students in those institutions, we are not sure whether we'll be able to comply with the health protocols that have been laid by the World Health Organization. And therefore, this poses a greater challenge to the education sector. However, having said this, it's also important for us as educationists. We are not just interested in saying that we are reopening the educational space and we are getting back to classrooms and having learners continue. When these learners come back to school, they are not going to be the same learners that we had before the pandemic. And there is no doubt we cannot purport that we are going to have a new normal. It is not going to be, we are not going back to normal rather, because most of these learners, especially if we take the pre-primary and the primary school children, even the secondary school children, they are children who are still growing and developing. And from an educationist perspective, the child has their world ordered in a certain way. And when the pandemic came, this order was distorted. And with this distortion, it means that the development of these children is no longer the way, progressing the way it was before. Therefore, what are the questions that we are not addressing, especially the policy makers out there who may not necessarily engage the educators reasonably in making decisions, for example, on reopening of schools or educational institutions, is that when these learners get back to school and they are told you have to have your masks on throughout, you're not to go playing and touching one another as they used to do before, and which they are continuing to do at home anyway, because children are playing in the neighborhood normally the way they would when the pandemic was not here with us. And therefore it is going to be a bit technical, in the sense that the policy makers may think that it's just a mechanical process of having learners back into the classroom, but to the educator and the learner in that class, it will be a whole psychological shift in the paradigm of how to handle these learners.
Maybe speak to the education point and the disparities in affecting workplaces. Adults are able to go to work, but children in Kenya have been prevented from going to school. That might create an elite children are continuing with their online schooling and homeschooling, but the children from poor areas are not getting the ICT and the laptops. So some thinking can be done around the legality of that. Is it legitimate to stunt or retard certain parts and certain groups of the population vis-a-vis others? So we need to think that through as citizens and as patriots.
With regards to law and policy making, I think there are undertones to this. So for citizens to respond to a police force, there is an established code. The police are the enforcers of the law, but also they protect the citizens. So in the case of South Africa specifically, we've had issues of police brutality, and the same applies to many African countries, including Kenya. I read a post of a young boy who was shot in the beginning when curfew laws are being implemented. The case of Zimbabwe as well, where police are using brutality to enforce COVID laws. So that breaks the code between the people they're meant to protect and their role as the police. So I think there is still need to uphold the rule of law, that the COVID-19 regulations must be implemented, but that should not be done at the expense of human rights and at the expense of people's freedoms. And we are aware that freedoms have been limited, like the freedom to move around, the freedom to associate. But when it transcends that and it oppresses people beyond COVID-19, then there is need for caution.
When they're in a state of emergency, for example, during this pandemic, people are told to be locked in. Now, in such a situation, sometimes people might be go against such a order and started going out. Now you can see that the police in trying to beat people and harass people. Some people also lost their life due to such situation. Now, to me, police should not use a maximum force, but should use a minimum force required by the laws, as required as enshrined in the most of the Constitution. One is about, so we must have laws and policies which will enable people to act in a right way, and not as it is used. Most police forces beat people, harass them. That's something required by the law. Police forces are the guardians of the law, should make sure they act within the ambit of the law as enshrined in what we call police auxiliary, which you guide police in doing their day-to-day activities that force.
I've written a paper criticizing the Internal Security Public Secretary Fred Matiang'i in Kenya, who on 29th of April made a proclamation saying all refugee camps should be closed. In other words, there's no movement into or out of a refugee camp, and there was not one COVID case inside the refugee camps. And it's coming from the security minister, not the health component. And it's illegal because we've been trying in Kenya for the past 10 years, because we're fighting terrorism, to lock and even kick out refugees, to close the Dadaab camp, to close Kakuma camp. And it's a clear manifestation of the internal security minister using the health pandemic as an excuse to finally isolate or shut down terrorism. So I agree with you that it should have come from the health minister, and I was petrified, and I've actually gone into print criticizing and saying it's an illegal order, it's discriminatory. There is no COVID in the camps at the time he made the order, and now that there's COVID, they can't respond to it properly because of the nature of his order. So in a nutshell, that's an example I can give, and I side with the health minister and not the internal security minister.
Issue of African countries being able to change, I think it's fair to highlight that there hasn't been a globally coordinated response to COVID-19. So as Dr. Kamala said, you're having Tanzania then initiating their own response with some of the guidelines from the World Health Organization. You have countries like Madagascar as well sort of paving their own way forward. And South Africa, which was lauded by the African Union for having a stance that aligns with whatever everybody else is doing, the conventional methods of responding to COVID-19. But what I think is that COVID-19 will certainly shape a new way of relation between African countries. And we're seeing, as Rengabo said, that the African Union has got a COVID-19 fund, which is the only continental COVID-19 fund. So perhaps it's highlighting the need for regionalism more than anything else. So people have to, countries rather, have to cooperate within the region, because what COVID-19 has done was to highlight that we have different experiences, international experiences, but overall, the African region has got experiences that are maybe different from how Europe has experienced COVID-19, from how China is experiencing COVID-19. So there's a rise in regionalism because of similar circumstances with either the cases, with obviously Southern Africa having the highest number of cases. So that means that there is more coordinated efforts that are needed amongst the Southern African countries, especially South Africa, which has been hit the most by COVID-19. But also we've seen how COVID-19 has shaped multilateral cooperation between European countries and African states. So often we had, in 2009, we had the G20 being resuscitated and coming back to tell us what to do in the wake of an economic crisis. But in the wake of COVID-19, we haven't sort of seen that coordinated effort at a global scale. Most countries are still keeping to themselves with bilateral cooperation here and there. We have Germany, and the United States working in terms of finding a solution and a vaccine for COVID-19. But there hasn't been much of multilateral cooperation within the globe. But also that is owed to growing sense of nationalism and a growing sense of right-wing policies. So if you look at the United States, for example, you have the rise of American first policies that are being championed by President Donald Trump. You had Brexit just a few years ago. You also have refugee crisis. So all that has drawn many countries to look at state-led policies or state-led responses and not really depend on multilateralism to respond to COVID-19. So I think in a nutshell that that's the context in which COVID-19 comes to play. And that's also what I think would affect how Africa relates to each other, and also how Africa relates to Europe. I think these contexts really play a very big role in terms of the global response to COVID-19. And as Dr. Kamala said, we need homegrown solutions, because how COVID-19 affects Europe has evidently been different, how it has impacted Africa overall. But while African cases, for example, in Tanzania, the cases are said to not have been as many as they are in the South African context, I think we also need to be cautious as academics and scholars not to downplay the fact that perhaps cases are not as many, because is there capacity to actually test? Is there equipment to actually test and see if people actually have COVID-19, and how many people are being tested per day? So I think those are variables that we need to bring into the context, as well as capacities to deal with it.
One thing that comes to my mind now is I notice there are disparities between different national responses, so that Tanzania is doing herd immunity, Kenya is doing, semi-lockdowns, not real lockdowns. Uganda had a permanent lockdown. So it's the same phenomenon, and how do we justify different responses? Are they all correct? John Pombe Magufuli is a professor of chemistry. He's popularly elected. He's filling stadiums of 60,000 people without social distancing, without masks. My one sentence response to that is that I think Africans are surviving because we are young and because of the good food. We don't eat junk food. So Magufuli looked at that and said, this is a problem for unhealthy populations. If there's obesity, our South African brothers and sisters, they are more prone. And therefore, he justified in his own situation, herd immunity policy is going to work for the benefit of the economy of Tanzania, and they don't want to be ravished by. And anyway, in his projection, there will never be a cure for COVID, just like the common cold. We'll keep getting it year after year. So in the long term, he doesn't want the economies to suffer, and that is so long as he has the legitimacy of the population, he's entitled to do that.
I think this is an eye-opener. The glaring deficiencies have been noticed in the counties about the facilities, and I think the government should invest on health, and we should not have issues of health workers being underpaid and so on. So if there's someone taking notes, this should be taken very seriously. But I also think there is need for us to explore herbal medicine. We have a lot of trees. We have a lot of trees which can cure, and we do not have to wait for foreigners to come and do research. So this should be followed up by the universities or research institutions. Let us invest more. Let us stop having to import drugs from all over. There are leaves which, if you take, you stop feeling headache, and we should invest more on that.
All right. So my contribution is not a question per se. It's just to add to what Mbura had said about traditional remedies and traditional medicines and responding to COVID-19. And I think because this platform has got policymakers and practitioners from different disciplines, I think the issue of having our traditional medicines, even research on traditional remedies in Africa, should go beyond COVID-19. And the reason I say this is because over the past years, we've been quick to adapt what the types of medicines and remedies we get from the Western world. So whenever we receive a backlash when we want to introduce our own medicines, it's because we haven't been championing that voice in academic literature and even in our hospitals. So it's then difficult for the world to then accept our remedies because our policies are not incorporating that. Our practices are not incorporating traditional remedies, and then all of a sudden want to go back to that. So I think in the post-COVID-19 world, this is something that we need to go back to develop capacities should we want to advance our traditional medicines. And also there's a need for historians to document how we have dealt with diseases, because we could have a solution to COVID-19. But like one of the, like James Chikwate said, the narrative, if we're not advancing that, if we're not documenting that in a methodological way that allows us to tell our narrative, then our efforts then become implicated.
From what we're learning about the pandemic is that we as individuals, at an individual basis, we need to come up with strategies that will help us be able to be in a position where when a pandemic comes in, whether the government is supportive or not supportive, we are able to manage the issue. That is my first point. Secondly, we also need to take charge of our health while at home. We need to be more open-minded to opportunities and privileges that will help us become the best versions of ourselves by taking good care of ourselves, eating right, and also supplementing with the right supplements.
I had written in the chat that there's this issue of PPEs being stolen and PPE money being stolen in billions. And we are civil society, we are academics. I mean, it's tragic. Okay, I heard something about South Africa, correct me. I heard something about Kenya, of course. And I hope it's not more endemic than that, because a minister has been convicted in Somalia. A minister. For 3 years, he has been imprisoned for health because he stole the PPEs. That's how it should be treated. We don't take ourselves seriously enough here. Here, people, you know, I think Jack Ma's COVID rescue package, which was given at the outset of the pandemic 3 months ago, has not even been disseminated, and I think it has been stolen. There were rumors at the time that it had been what Nairobi Hospital were giving and charging 10,000 shillings for was Jack Ma's, what he had given free as a donation. I don't know, as a society, we have a long way to go. Everyone is becoming demoralized. If people are enriching themselves at the expense of death, at a level of attitude and I think the national values that the population can rally together against COVID as a war, I'm not seeing that solidarity is there, even in classes like the haves and the have-nots and so on.
Well, not just South Africa, rather, but we also had in Southern Africa region, the case of Zimbabwe, which sparked the protest when the health minister was also arrested because he was implicated in this corruption of COVID-19 funds. So it's really endemic, and it was before COVID-19, and it still is. So we need to strengthen systems of checks and balances, accountability, and also revert to democracy and upholding and knowing that the people are really the ones who should take priority in whatever governance in a democracy.
Yeah, there is a correct information gap between the rural populations and the urban populations. The rural populations do not have the luxury of TVs and all those equipment to hear directions and guidelines from the Ministry of Health or the government in general. So they depend on social media, and social media is really doing a thorough job, and especially information from Tanzania, which is really affecting people. That you see in the urban areas, we have the correct information. Probably the government should come up with official social media networks or social media to pass the correct information to these people. So, and they should flood those populations with the correct information. But beyond that, I feel we should not spread fear, but we should spread the possibility of people being able to live with this pandemic.
First, when this thing is over, we want to know why China took so long to tell the rest of the world about the epidemic and why planes left China and infected the rest of the world. That's a serious issue. They may even be prosecuted.
Who is driving the narrative? The so-called Western pharmaceutical firms. They might want to treat our way of doing things as bizarre, not scientifically proven, yet it has worked for our people. So if we allow the Western world or the European, American pharmaceutical companies to drive the agenda, then could it be they want to do business and they are not happy when they see that Africans are not dying in their thousands and millions. That's why they had to discredit the Madagascar thing. Even when you are saying, I'm sure in South Africa, you have got your own ways of dealing with pandemics. In Kenya here, various communities had their own ways of dealing with pandemics. This is not a new pandemic to most of our communities.
Of course, the reason our governments use copy-pasting models is because they don't want to invest in long-term strategic processes. R&D takes time, and a politician is interested in only 5 years, so they fear investing in a 20-year, 30-year program would not be politically beneficial. So they resort to this short-term approach to managing things. But I think this has woken all of us up. One of the things that is increasing the self-confidence of Africans is the breakdown of the invincibility of the Western world. It's no longer the case that we are going to say America, Italy, UK, or Western world is better able to manage pandemics than other parts of the world. And this has signaled to the rest of the world that the developing world, as much as the developed world, can be equally uncertain or even equally endangered by a situation like COVID-19 pandemic. I think it's now time that we invested in R&D about our indigenous health and medical systems, technologies, and products, so that we can bring them to the fore, as Cynthia said, not just in the management of COVID-19, but also in management of all our health problems that we have historically been managing. I think if we combined a lot of our indigenous knowledges and technologies with Western knowledges and technologies, we could craft a very effective health system or infrastructure for different African countries. The other thing I would like to talk about is the importance of prioritizing and building capacity. Of course, here in Uganda, President Museveni has been repetitive in talking about supporting and facilitating scientists to develop not just their capacity, but also to become motivated in terms of the rewards they get from their efforts. And of course, rhetoric in political analysis, rhetoric is different from action. We don't know what he's going to do in addition to what remarks he has made. But it is important in terms of health. But also, we have seen that COVID-19 is actually more of a social problem than a health problem. So we need to develop capacity in different realms to be able to manage both this and future pandemics. Finally, those who are engaging, especially those of us who are in policy research and advocacy, or who are in the legal profession engaging policy makers, we need to begin to challenge ourselves, to challenge our governments, to build and instill self-confidence.
In closing, I'll probably say that there shouldn't be the perception that we are blindly following WHO or external. We should, as Africans, for once in our existence, be it Madagascar with its innovation, I think that there is something to be said about doing what is homegrown and trying, if it's working, something should be said about that.